We're going live on Facebook now. Sharing exposed, bring your share in the front. Okay, great. You're going to great. Now let me make sure that I can record this. I think we're live now on Facebook. So now let me see, where can I record it? Sorry, it's just sometimes this would be resume share. And then resume recording. Okay. I hope that you can hear me now. We are going to start our webinar. We started over a month ago our program that was detox and lose weight. The first phase was the detox phase, and then we are continuing today talking about weight loss. And for weight loss, we are going to talk about a very unique program that has been heavily researched and studied, not for the last few years, but actually for so long. So I'll start by asking about what are our goals? What are our goals when it comes to body weight? So weight is important. So like, how much do you weigh? Okay, how do you look? Your image is very important. But also the body fat percentage is important. So you want to lose weight, but you also want to preserve your lean muscle. You don't want to lose muscle. Okay, your waistline circumference. You want to lose from the visceral fat. Okay, you don't want to lose any kind of like fat, like brown fat. You want to lose the visceral fat that you start collecting from early on. Also, you want to maintain healthy levels of your blood work, like high blood pressure, high cholesterol levels, your metabolic markers. You want to keep them in place because like weight comes with a lot of problems. We have problems with diabetes, pre-diabetes, we have problems with blood pressure, heart problems. So that's another thing to look at. And also we want to talk about the energy level. Okay, so we want to keep and preserve our energy. Okay. So have you ever said, I'm struggling to lose body fat and weight, but I don't want to lose the lean muscle mass? I think this is something that we all say. Have you said like, I'm seeking to feel rejuvenated? What does rejuvenated means for you? I mean, do you mean more energy? When you wake up in the morning, you feel like you don't have the brain fog? Do you mean by this is like you have better sleep? Have you ever said, I am looking to improve my energy levels and make healthier choices? So that's like kind of questions that you ask yourself and you kind of daydream about them. And then days and years pass and you never do them. So that is what we're looking for. We're looking for achievable, attainable goals. Okay, so let's say, what is fasting and why are we talking about fasting today? First of all, I want to say that fasting is as old as humanity. Actually, all the religions, if there is differences between religions, we see the common thing between religions is that they all fast, different forms of fasting. So if we say just what's the meaning of fasting, we say that it's to abstain from food and beverage, not to drink or eat. But there is also the biological fasting, which is to not consume the foods that trigger the cellular food sensing pathways. And by that, we mean there are certain foods that make you hungry. And that starts up to 24 hours after the last meals. Okay, so that being said, if you take the last meal 24 hours ago, your biological fasting starts 24 hours later. So if you're eating meals that make you feel you're hungry, that is kind of what we're talking about. But then there is a misconception that we say is like juice fasting is fasting because it does not contain solid food, for instance. We want to focus today on the biological fasting, with food sensing pathways. Okay. So, as we said, fasting is as old as humanity. It originated with the ancient evolution and the healing tradition across the millennia. We don't know a prophet or someone from the old age that was not fasting different ways. And fasting has always been the common thing that people were doing before because there is not too much food. Okay. It has shown to support overall metabolic health. I give an example, and I keep giving this example, that we learned about fasting from prophets, and prophets came with message of God. And this is a very rough thing to do, to deliver a message from God to the people. And if they were fasting, it's not just to help it clarify their souls, but I think there is also something more into it, to help their bodies be stronger and be able to do the mission that they are here for. But other than that, since fasting is very old, it has been studied and it was shown to support cellular cleanup that leads to cellular renewal. And soon we're going to learn about a Nobel Prize that was handed to the scientist who talked about autophagy or the cell cleanup. And this professor actually, he learned the program, how the cell cleans itself. And that was also related to fasting. So fasting promotes also longevity and health span. And that's what we're gonna see. When we talk about the diet trends, we have to say that fasting was #1 diet pattern in US in 2018. Intermittent fasting was the #1, that was #1 trending pattern 2018. There was this paleo diet, gluten-free diet, low carb diet, Mediterranean diet. Okay, so many dieting programs. We're choosing fasting today for a reason. Okay. And I want to say that the fast mimicking science and fast mimicking diets, it's not something new. Like people have been doing the intermittent fasting, which is like there's difference between intermittent fasting and other type of fasting and water fast, and we'll talk about that. So it's just not something new that we have. Actually, the program that we're talking about today is followed now by over 220,000 people across the world in over 15 different countries. So it's a trend and it's trending more now. When we talk about the type of fasting, we have the intermittent fasting, in which we fast less than 2 days. One of them is a time restriction eating, 16-8, or a circadian 12-12. So like 16 hours you're not eating, and 8 hours only you're feeding or eating. There is also the fasting of 5-2. You have 2 days of fasting only, and 5 days you're eating. Okay, so you just choose 2 days in the week that you're fasting only. Or there is the alternate day of fasting every other day. I think Prophet Jesus was alternating the days of his fast every other day. Okay, intermittent fasting. So yeah, prophets were fasting. Also, but then there is the prolonged or periodic fasting, which is more than 2 days. And we're going to talk about two of the prolonged fasting, and hence the word Prolon. The water fast, or fasting with water. So for about 3 to 5 days or 7 days, you're only drinking water, just water, plain water. Okay, who can do it? Question mark. And then the other type of fasting, the genius type of fasting, is the fast mimicking diet, in which you're fasting and at the same time eating food. When we talk about fast mimicking diet, people think that we're talking about the ketogenic diet, and we're not. But before I tell you that, I want to tell you about the water fast. Water fast is like something that's very hard for us to do. Water fast can make you lose muscle mass, cause headache, gallstones, and cause other health issues. I was in a room full of clinicians, and like more than 100 clinicians in the room. And then Jim Lavelle, America's voice of integrative medicine, he was asking a question: who in the room did the water fast before? And only 2 people raised their hands. And they're very affluent people from the community. And just the reason is because it's very hard to do. Okay. So water fast is what we're focused on. We want to do it and at the same time make it easy for us. Now, when we talk about the fast mimicking diet that focuses or gets its benefits from the water fast, the difference between it and the ketogenic diet, because people think that this is a keto diet, we see that there is huge difference. One of them is the composition of the diet itself. Fast mimicking diet is high good amount of fat. There is low amount of protein and there is low sugar. While the ketogenic diet, we have high fat, normal protein, and very low in carb. Duration of fast mimicking diet is just 5 days, just 5 days in the month. But the ketogenic diet, we're talking about several weeks to months in order for your body to be in the ketogenic state. We have fast mimicking diet is designed to mimic physiological and cellular fasting, so your natural way of living. This is the fast mimicking diet. This is how we are designed to do, to actually fast like the fast mimicking diet. While with the ketogenic diet, we're just trying to mimic the physiological fasting. We have the fast mimicking diet. It's also fast initiation. It happens you can be in the state within a couple of days, the state of fasting, and you move from burning sugar to burning ketones and fats within a couple of days, while the ketogenic diet is time dependent according to the program that you follow. With fast mimicking diet, we have proven results about the rejuvenation of the cells. But like with the ketogenic diet, we have cells likely sensing the nutrients, and sensing the nutrients would make the fasting not going in the direction that would be helping to protect the cells and help with the anti-aging purposes. With the lean body mass, with fast mimicking diet, we have protection to the lean body mass. With the ketogenic diet, it's dependent according to how you're going or how would you approach the fasting program. And last thing, the positioning of with fast mimicking diet, we're looking at the weight, metabolic, and the aging. So we're not looking at just one component. On the other hand, the ketogenic diet, we look at the weight and the metabolic and also how you feel like brain-wise, your brain health. Today, we're talking about Prolon. And Prolon or prolonged fasting, it's the first to market fast mimicking diet program backed by research. And there are clinical trials with results that came out talking about like what is the results of the fast mimicking diet. And the beautiful thing is that we have the data to support that. So there was clinical studies to see how does the fast mimicking diet affect the risk markers or the risk factors for aging, diabetes, cancer, and cardiovascular disease. And I'll show you some really good information. So when looking at 3 cycles of Prolon, which is what we are recommending, and by that we mean only 5 days in the month you do this fast, taking the meals from day 1 to day 5, okay? So they were looking at 100 people and looking at the weight loss, BMI, body mass index, abdominal fat reduction, and maintenance of the body mass. And we have here the blue is the control, and the fast mimicking diet is this green. For body weight, there was like a mean of 6 pounds of loss per for visceral fat, okay, for the 3 cycles. Body mass index, we see here the fast mimicking diet is better. The trunk fat, this is the fat that's harder to lose, and that was significant with the fast mimicking diet. And at the same time, lean body mass, protection of the muscles, it was very prominent with the fast mimicking diet. These clinical trials that were proven to work, okay. The other thing is healthy aging. And by healthy aging, we're talking about the food sensing pathways that are, when activated, they would cause more aging of the cells, fast aging of the cells. Okay, one of them is IGF-1. This is one of the food sensing pathway. If it's activated, it causes more and accelerated aging. So with the fast mimicking diet, which is significantly less and actually like not activated, okay, with fast mimicking diet, with regular fasting, with the control, you don't see that effect. The other thing that I want to say is like the heart markers, the metabolic blood pressure. We see lowering of the high blood pressure with the fast mimicking diet, and we see on the blue line here there's about 5 points of decrease in the blood pressure. And the nice thing is, after 3 months of fast mimicking diet, we see the prolonged effect of this physiological pattern of lowering the blood pressure. So you're not just getting one thing. So when we're talking about the fasting impact with the fast mimicking diet, we have here the comparison between the caloric restriction, not eating enough calories every day, intermittent fasting, periodic fasting, and fast mimicking diet. With caloric restriction, we're focusing on all of them, we're focusing on the weight. So we're losing weight with all of them. But when we come to the lean body mass, caloric restriction, it depends on the program that you're following. Intermittent fasting, it also depends on the program that you're following. But with fast mimicking diet, you're actually protecting that. And this is just another slide to show you the comparison. I just focus here on the safety of the program. Here you're with the fast mimicking diet and the intermittent fasting. This is more of a safer option to use for fast mimicking diet, and I'm going to discuss it more, who is this for and who it's not for. Also want to say that I'm talking about actual meals, and this program is not also revised by the FDA, so this is also like the science of this is like the science of food. We're talking about clinical trials, we're talking about ways of dieting, but we're talking actually about actual foods and meals that we're eating, but it's not revised by the FDA. Just wanted to make sure that you know that. Now, prolonged fasting or water-only fasting. If we just do water-only fasting, we're losing weight, we have better metabolic health, we're supporting cellular cleanup, and we're supporting the sense of well-being. But there is also like other things that we're getting. Because with the brain, what the body does when we go on the fast mimicking diet is that the glucose get to be pushed to the brain. There's enhanced network of plasticity, and you would see your brain function are actually improving. With the liver, you're having more detox that's happening in the liver, and you're having lower activity of the IGF-1, which is one of the pathways, hormones that would affect and accelerate aging. When it comes to the gut, you're resting your gut, you're actually giving time for your GI tract to rest and relax. You help it with energy uptake and cellular proliferation. It's helping also with the microflora in the gut. With muscles, we're helping with the lean muscles. And when it comes to the fats, we're increasing lipolysis, breakdown of fats, and we're focusing on the trunk fat. Okay. Now, with water-only fasting, we have some disadvantage. It's very difficult to do. It does not preserve lean body mass and gallstone risk. We talked about that. We have a very peculiar scientist, Dr. Longo, who 25 years ago went to the NIH and asked them for funding in order to come up with the different type of dieting. So he got about $36 million, and he used it to do studies on the anti-aging medicine and helping diet that would help with anti-aging. Okay. He was focused on the elevation of the food sensing pathways, accelerated aging process. Certain hormones would increase aging, and if you just decrease their activity, you would decelerate the aging process. He came up with this program because the fast mimicking diet is actually taking all the important elements of the breakthrough product. So it helps with kind of mimicking, as your body is actually in a water fast. It's plant-based. It has a lot of trials behind it. It's published in top medical journals. So it's not just a point of view or some doctor's diet that you're following. The nice thing about the fast mimicking diet is that we're doing it only 5 days in the month. You jump started very quickly. You're having actual meals. Between day 1 and day 2, you're having the fasting state. And then day 3 and 4, ketosis and autophagy. And autophagy is the cleanup of the cells. And then after that, day 5, we have the renewal, the transmission to refeeding beyond the day 5. And you go to day 6. This is actually the day that you're getting back to eating normal, day 6 and beyond. And actually in the clinical trials, people were not asked to eat any different kind of foods from day 6 moving forward. They were asked to just eat normal again. And then next month, redo it again. you're just training your body and your mind in order to eat healthier, because you've been doing it for 5 days and you see the weight loss that you have, rejuvenation that you have, the energy that you feel. You want to keep that. And that's very important component of the fast mimicking diet. I want to tell you about fast mimicking diet, and I would just compare it to a tiger. Think with me about a tiger. The tiger is feeding now, is running after the prey, eats the prey, and he goes fasting after that. The tiger is not going to eat until the next prey, and it can take days for that. So the tiger, next prey is going to be top speed, top muscle, top focus and concentration, going to run after the prey and get it and eat it. Okay, that is fast mimicking diet. We see optimization of the cells, optimization of the muscles, protection of the lean muscle, and you do it. Okay, look at these beautiful slides. We have here the traditional Western diet would be affecting nutrient sensing pathway. The activation of these will tell you, I'm hungry, I'm hungry, I'm hungry, I want to eat, I want to eat, I want to eat. So what you get is old Warren intracellular components. You would just kind of use your body and your body cells faster, okay? That's a traditional diet. But when we do with fasting and water fasting, you're not affecting this nutrient sensing pathways. So you're actually helping telling the cells, protect yourself, make sure that you're optimized. So you have intracellular cleanup or autophagy that we talked about. That helps to protect the body, decrease inflammation. That's fasting. Now, what happens with the fast mimicking diet is that you're eating, but you don't have enough of the foods or the triggers that would cause this nutrient sensing pathway to activate and go to the level of kind of affect the autophagy. So we see like you would get, the nutrient sensing pathway would go up, but it doesn't go to the red zone. So you still have the autophagy works. That's why some people come and say, okay, I want to do the fast mimicking diet, but I don't want to, I want to do it on my own, not taking the food. But telling you about those foods contain more than 86 ingredients. It will be very hard to mimic it. And I understand it can be expensive for some people. I have some good news about that at the end of the presentation, but it's actually meals that you're eating every single day. Now, when we talk about weight loss, you're going to lose an average of 5.7 pounds of fat, visceral fat, 1.2 inch of the waist circumference. That's according to the trials that we have seen, protecting body mass. I'll tell you about this slide. This is like, they've been following the people on the fast mimicking diet 3 months after they finish 3 cycles. So 3 months after they finished 3 cycles, and they found like 60 of them are preserving the waist circumference, how much they lost. About more than 55% are still keeping lower blood pressure. There's people with higher blood pressure. And when it comes to body weight, they still kept it low, 64%, and body mass index up to 71%. They kept preserving what they have lost. So the orange line is changed 3 months after the 3 cycles, and the blue line changed after 3 cycles only. So we see prolonged effect. Part of it is because after you do something for 3 months, it gets to be a habit, and then there is mind-brain connection that would kind of get you to how your body used to be with your ancestors, because our parents, our grandparents, they didn't eat as much and they were fasting more, and we're kind of getting back to how our bodies should work. That's how I would say it. So with fast mimicking diet, we're clinically shown to help promote cellular cleanup, reduce body weight and fat, and maintain healthy levels of hormone IGF-1, insulin growth factor 1, which has been implicated in aging and disease. Trying just to simplify things. It's just 5 days, meal plan, unique nutrient ratio between soups, teas, crackers, some nuts, olives, okay? Providing nutrients to avoid malnourishment, because we don't want you to lose the muscle mass. 220,000 users have used it across 15 countries until now, and then it just was safe for them. And there is carefully tracking of the effects of the fast mimicking diet. The program that we have is actually the professional one, and the professional one that we're offering contain low inulin and grains, doesn't have any nightshades, and for that, like, we just wanted to make sure, like, we're not having anything that would aggravate more. What can we say? We wanted to make sure that of a program that's suitable for everyone. Okay, the program is nut based, so if you're allergic to nuts, it's not recommended for you. Now, as we said, no nightshades. We have 83 ingredients in the Prolon program, so mimicking that is not easy for people who want to go just without the program and tell you, like, I'm going to fast on my own, the fast mimicking diet on my own. It's very hard to do. This is 25 years of research, so that I want to tell you. It's a very good and efficient way to lose weight. Most of it from the circumferential fat, the fat that's harder to lose, that you start build up when you're 20 years old. And it's just 5 days of lifestyle changes per month for 3 months. Then you wait and you can always renew it. And the effects persist after returning to the normal diet. That's the beauty of it. And you go back to normal diet, you don't eat excessively after that. That's how you keep it happening. Okay. Now, when we talk about systolic blood pressure, we have seen these results, is that if you have high blood pressure, your blood pressure is going to be better after the 3 cycles. For people who tell me, okay, I want to do just 1 cycle, do I get the benefit? So yes, you still get the benefit, but not as you do it for 3 cycles, because we are focusing on training your body into the new you that you want to be. Because at the end of the day, food is medicine, and you are a slave of your own habits. We're trying to keep a habit going for 90 days. That's beautiful. It's just 5 days. So that's why it's a good program. Now, of course, a lot of surveys, and we already touched on some of this information. I get a question of who is Prolon for? And Prolon is for people who want to lose weight, want healthy aging support, rejuvenation of the body, and metabolic balance support. People who want to lower their blood sugar, helps with the cardiovascular health, because as we saw, the cardiometabolic panel gets to be better. You're not going to use Prolon if you're allergic to nuts, oats, sesame, or any components in the meals, the actual meals that you get. It's not recommended for pregnant or breastfeeding women. For people who have an active infection or risk of current infection, malnourished or underweight, or pediatric or less than 17 years old. It's not recommended for diabetic patients because, if you're on diabetic medications and you go on the fast mimicking diet, your blood sugar is can go very low. If you're on blood pressure medications, check with your doctor first to see if you can do it. You can check with me to tell me the exact medications that you take, and I can recommend to you, and we can communicate with your doctor to make sure that it's okay for you to do it. Now, what we're getting with the fast mimicking diet is that not just we're losing weight and helping with the biological markers, but we're also motivated to adopt a healthier lifestyle, because at the end of the day, we don't want you to be eating healthy, to be eating like fast food every other day. We want you to adopt a healthier lifestyle. So there is motivation. 89% of people are motivated, according to a survey that was conducted by L Nutra, the company behind the fast mimicking diet. We have more mindful of what you're eating, 80%, more control over the health, because you're not, okay, fast mimicking diet, in the first day, you're getting about 1,200 calories. Second and third and fourth day, you're getting 800 calories, okay? That's less than what you've been eating the rest of the month, okay? So you have more control over your health. You feel to be in control. You feel empowered. And of course, you have established healthier eating habits. Okay. Now there's some medication consideration. Of course, I talked about the sulfonylurea and the blood sugar medication. The meals that you take is like 5 days of meals. Okay. But you drink as much water as you want. We want to make sure that you don't have electrolyte imbalance. We want to make sure that you're hydrated very well. You get a drink that you drink, I think, starting from day 2. You're not mixing the days. So like day 1, day 2, day 3, day 4, you don't take meal 3 in day 2. It's a simple and also a complex program working on how your body is acting in order to get into the fasting stage and rejuvenation stage. So that's very important. And if you have some specific consideration about medication, just let me know. But we have seen, and with working with several doctors, the Prolon program can be taken with a statin, aspirin, NSAIDs, PPIs, acetaminophen, non-drowsy allergy medication. It would be kind of recommended that you would just check with your doctor if you want to go through this diet to make sure that everything is fine with what you take. Check with me to ask me about the medications that you take, and I'll tell you like what you can do and what questions you can ask your doctor to make sure that the doctor is also on the same page. So, fast mimicking diet. Towards the end of the 5-day fasting, we have less food craving once fast was complete. Let's say you drink soft drinks every single day for 5 days. You're not doing that. You're not eating those fast foods for those soft drinks for 5 days. What do you think is going to happen on day number 6 and 7? Are you going to get back to grabbing this soda, or it's going to be harder for you to do it? So you have less food craving because the food sensing pathways are different. You have improvement in the mental clarity, improvement in the focus, and you have greater energy levels. So, in summary, after one fast mimicking diet per month for 3 consecutive months, we're talking about 3 cycles, we have IGF-1 is lowered, the hormone that's like helping with the food sensing pathway that just affects accelerated aging. We maintain it at healthy levels, so we're helping with feeling younger. Systolic blood pressure maintained at healthy levels, lean body mass, and the weight loss is reduced. The value of Prolon is really extensive. There is behavioral impact, well-being, healthy aging, sustainability, and safety among about 220,000 people. I have tips for better experience, but before I tell you this, I want to tell you that when you are on the fast mimicking diet, the clinical research is showing that if you are in the like let's say if you already have good blood pressure, okay, your blood pressure doesn't fall to dangerous level. No, actually it's actually maintained in healthy levels, okay. If your blood sugar is less than 99, your blood sugar doesn't fall to bad levels. And the reason is because the fast mimicking diet is just working around your natural body habit that we're just going against when we keep feeding every couple of hours, okay. So that's why I want to tell you, like, it's not going to be dangerous if you go on 1200 calories or 800 calories for 5 days in the month, okay. And ask people who go through intermittent fasting, and they're going to tell you like how they feel after the first and the second cycle. The other thing I want to tell you is the second cycle is easier than the first cycle, okay? And there are tips that I'm going to tell you now. So you have herbal teas that you can drink as much as you want from it, unsweetened and caffeine-free herbal teas. That's going to help you with better experience. You can take up to 2 pieces of sugar-free gum per day, 2 slices of lemon per day. That is kind of tips to help you go through the days, because you can just come and say, okay, I feel so tired, so lost on day 3, and now I want to grab something to eat. That's a hamburger. So these are kind of tips. A teaspoon of Himalayan salt, as long as there is no health contraindication with that. A tablespoon of dried herbs and spices per day to enhance the flavor, unprocessed. All types of sparkling water are fine. No sweeteners of any kind. We're not telling you to take any of the sweeteners in the sparkling water. And caffeine, okay, so if you want to take caffeine up to just 8 fluid ounce of cup that doesn't have any sugar or cream, it's very important. You can take 2 cups of black or green tea, and there is also decaf coffee that you can take up to 6 cups. So you see, you have options to do different things, and just 5 days. And if you're really struggling, sit down, drink a bit of the Ella drink. Ella drink is a drink that's inside the box that you have, and breathe calmly. Yoga would help a lot to get you through the 5 days. And as I tell you, like, first cycle can be the first one, and then there is a second and the third cycle. And also, when you sign up with us for the Prolon program, we sign you up with a fasting coach that's going to help you with phone calls, with emails. You can ask them, you can call them. They support me and help me with the program, and they're going to be trained to help you go through the 5 days of the program. Okay, and if you're still struggling, you may take 2 slices of a small apple. So you see, giving you a lot of tips here, just from step 1 to step 2 to step 3. Feel free to send me an email or ask me a question or call me and ask me a question how you can get through this. But I tell you, like, the box is fine, 220,000 users, and they're growing. The company has very strong support in the medical community. And I think I came to the end of it. I just want to tell you that we were offering the program at $225 for a 5 days program, and we decided today to slash the price to $199 for a month for a cycle, and that includes a support program, because we want this to work. We don't want to just sell you a program, we want this to work. So $199, you have me, you have the support program from the health coaches, and think of it as like $200 divided by 5, so that's $40 of meals a day. $40 of meals a day. Think how much you go and spend on eating on a daily basis. The boxes that you get is all the foods that you actually eat. So it's like, this is what you get for the 5 days, in addition to drinking water. So that way I can just tell you, like, you can think of it as not too expensive, and you do it for 3 months only. Last thing I want to say is, for people who already paid for the program, $225, we're going to be sending you $25 gift card that you can use towards future Prolon boxes, or you can use it to buy any kind of supplements and at Wiltopia. One of the questions that I always get, if I'm taking medications, do I keep taking them? And I tell you, yes, we're giving you a program to help support you, not to take something from you. The thing that I see happening with the Prolon is that you might not need to take all of the supplements that you're currently taking, and you can check with me. But because the program is can give you a break from some of the supplements that you will be taking, so that's why we try to make it comprehensive, because the program also contain supplements to use through those 5 days. It's kind of a standalone program, but it works very well with other kind of I would say medications and supplements. We want the doctor to always be in the conversation, so just want to make sure you understand that, and I would be more than happy to answer any questions that you would have. I was muting all of you, and I'm now going to unmute. I'm going to allow you to unmute yourself if you want to ask any question. If you have any question, you can ask a question. And if you don't have a question, you can always email it to me at wiltopia@wiltopiarx.com, or call me at the pharmacy, or leave me a message, or text me at 262-429-9429. I think I have a question here. Does it come with any daily supplements, or do we just talk to you about what we're taking daily now? So the box come with kind of multivitamin and some essential fatty acids, and you can just tell me the supplements that you'll be taking, and I'm going to tell you specific information about the supplements that you take and what you can take and what you can give yourself a holiday from. Because one of the things about supplements is that supplements are not medications. So supplements, it's good to make it always interesting, so you're not just taking it every single day and night. We want it to be interesting. So I tell people, like, if you're taking a certain supplement, take it for 3 months, take a holiday for a few days, get back to taking it. So we want it to be interesting. So you can just ask me about the supplements that you take, and I'll tell you like what you can continue taking and what can be like you can take a holiday from. So yeah, elderberry and zinc and vitamin D. Yes, you can continue with taking those while on the Prolon program. elderberry zinc and vitamin D. Well, actually, the elderberry zinc, you can wait on it for a few days, because when your stores of zinc are complete, you do not need to take as much. So if you're taking elderberry zinc for a few months, you can take a holiday from it for like a few weeks and then get back to it. With vitamin D, well, I would continue on vitamin D without a problem while taking the Prolon, as long as it's over the counter, not prescribed. If it's prescribed, you just take the permission of the doctor first. Okay, I think I'm done. And thank you so much, everyone, for attending this webinar. It's going to be available on Facebook and also as a recording. I hope that I did not mess it up and I already recorded it. But really, thank you and for attending today. And I wish you would have beautiful program with me. This is not a program that we want to just to give it to you or sell it to you. We want to make sure that this works for you, and we're here to support you. Thank you and have a wonderful night.